Hello, everybody. My name is Evelyn Inga, and today I'm gonna talk about this study. It's a randomized controlled trial and economic evaluation of the Families for Health program to reduce obesity in children. We are gonna talk about the selection of statistical tests and analysis. We're gonna cover here for that the sample, what are the primary outcomes and what is the secondary outcomes as well, and the dependent variable, the independent variable, what kind of variables they are, statistical tests they decided to use, and the results if the statistical tests give outcomes that fits good for this study. So let's go ahead. The sample. So basically, this is a study that has to compare two groups. FFH group, that is the family program, Family for Health, and the usual care control group. The FFH program, let's call it V2. Why V2 and why not V1? Because it was a program that it was designed for the entire family, but in a really active way. What does this mean? That, for example, the siblings of the children can go out to run as well, can join physical activities. Even the parents has to do, and they have to do physical activities as well. And they even have a pedometer to count their steps. They have to go with the advisor and just to check up every day in 10 weeks for 2 hours and a half, just to check up how they are doing, so the advisor can tell them, hey, you have to exercise, you have to walk more, oh, don't eat fries while you went to McDonald's or something like that. And yeah, in the usual care control group, this is a study that was made in UK, and they have a regular a regular plan for the children, and it consists in just they have to go every week, every once in a week. They have to go with the advisor, and they have to tell them what they are doing in their activities, but that's pretty much it. And even they have to measure the weight. The nurse have to measure the children weight, and the same for the rest. And well, this is made in children between 6 and 11 years old, and they distributed all the children's families, in these two groups. For the first group, that is the FFH group, we had 56 families, and for UC group, we had 59 families. These are the groups that I'm talking about, FFH. Oh, and I say V2, why? Because the FFH, they was the V1, they changed it a little bit. Why? From 12 to 10 weeks, because they say, oh, it's almost the same, and it's just their preference. They don't explain more, they don't explain further. So we are gonna call this group the V2 group, just remember that. And the usual care group, that is what I talk, is the regular control group for children with obesity in UK. So the outcomes, the primary outcome was a cost effectiveness. So what is particular in this study is that they have to measure for cost effectiveness. First, they have to measure the BMI, and that consisted um, to measure the BMI um, at the baseline and at 12 months. And the ICER radio, and the ICER is a radio that is a difference between the mean cost and divided by the difference in mean outcomes at the baseline and at 12 months between the trial comparators. So, kind of the ICER index depends on the BMI score, right? So I was like, that's why this is a quite particular um study, but nothing that is complex. What are the variables? So we have two variables, right? The dependent and the independent variable. The dependent variable um, is gonna have data that, as the name says, is gonna come from, is gonna be dependent from the the group that it comes from. It is gonna come from the independent variables measurements, which are the FFH group, Families for Health, and the usual care control group, V2 and UC group. And the dependent variable for this will be the BMI Z score and the ICER index. What kind of variables are they? The independent variable will be just categorical variables. Why? Because they're just the patients and the children. We cannot measure this. One children is better than another children. No, we can't, and they are just groups. And the dependent variable, we can measure this. Their numbers is a continuous variable. Why they did with this information? They described that um, every every parent, okay, from the FFH arm, they have to describe the BMI from the kid, and then they have to give that to the statistical group, the nurses, and what they did with this information, they just provided the means, they provided a standard deviation that was the measure of dispersion, and the confidence intervals. All of this for the continuous variable. So the statistical test they used, it was the median for the MCT and measure of dispersion, standard deviation. The outcomes were analyzed through the t-test and chi-square tests. I forgot to mention that the secondary outcomes were if there was an improvement in a psychological psych in the children, and it was good. It was not so, and it was really good. Oh, no improvement. So they did that with chi-square tests. Why? Because this is just a categorical variable. It will be an ordinal variable. Why? Because good is absolutely better, is above bad, and very good is above good. And how we analyze these dependent variables is that we have to use chi-square because they are categorical. So this is the information. Again, they just try to compare baseline and at 12 months, and they just want to see if there was a difference right? There is the mean, and the standard deviation was the measure of dispersion, the confidence interval. So they collected the outcome measures at home visits at baseline, 3 months, and at 12 months post randomization. Yep. Then, what were the results? From 115 families, 128 children in total included in the study, and 56 with 56 allocated in the V2 group. We talked about that before, and 59 in for UC. And they conclude that this program wasn't neither effective nor cost effective for the management of obesity. This trial does not support local and national implementation of this program. So pretty much this is quite a study that covers everything, and it is well developed. It has a fluent narrative. You can understand pretty much everything. It was straight to the point about the results. Right, we have these variables that are continuous. You have to use the t-test, no, t-test, yes. And for the dependent variables, the dependent results that you are going to have, you have to use, they are categorical. You have to do chi-square. So yeah, I consider this a good study, pretty much, with some stuff that they're off. They don't describe like on the tables. That was the thing that I would like to improve. The tables descriptions, they were pretty much off, and maybe to put a little bit more of information there. That's it. My name is Evelyn Ninga, and this was my project. Bye. How I close this?